So for the majority of patients and families affected by frontotemporal degeneration, or FTD, genetics doesn't play a huge role. We do find that in about 15 to 20% of patients with FTD, there is a known genetic cause that can be inherited through the family and is the ultimate cause of why the FTD is occurring. The most common genes that can cause an inherited form of FTD are a gene on chromosome 9 called C9orf72, a gene on chromosome 17 called the tau gene, or microtubule associated protein tau, or another gene on chromosome 17 called progranulin. All three of these genes, if there's a change or a mutation in the gene, it can affect the body, trigger the pathway to FTD. In those cases, there would be inherited risk. The inheritance is something called autosomal dominant, which means that for an individual that has the genetic form of FTD, every single time they have a child, there's a 50% chance that they'll pass on a copy of the gene that has the mutation that causes FTD, as well as a 50% chance of passing on a copy of the gene that's just fine, does not have any mutations, and would not cause a subsequent child to have a genetic risk for frontotemporal degeneration. Anyone who's interested in genetic testing for FTD can certainly talk to their doctor or a genetic counselor about the testing that's available. For all three of the genes, the progranulin, tau, and C9orf72, there is genetic testing available. Typically, this testing requires a small sample of blood, and what the laboratory would do is they basically spell check those genes. They look to make sure that the genetic information is all the way everywhere that it's supposed to be in the correct order, and basically it's making sure that the gene is spelled correctly. If the lab did find a change in one of the genes, they can tell whether or not that change is something that would cause a genetic form of FTD. As to who should get these types of genetic tests, we know the highest risk is to individuals that have a family history. So people that have multiple individuals in their family that have been affected by FTD, as well as ALS, or amyotrophic lateral sclerosis, because we do know there's a strong connection between those two conditions. As well as, even if there's a family history of other neurodegenerative conditions, or you're not quite sure what the family history entails, talking with a genetic counselor or a clinician experienced with FTD can help get that family history information and discuss whether or not genetic testing would be an appropriate course of action. I often get asked questions about the genetics of other types of neurodegenerative disease, and one of the most common ones is Alzheimer's disease. The genetics of Alzheimer's disease is entirely separate from frontotemporal dementia. With Alzheimer's disease, when it comes to the genetics, we look at whether the condition has an early onset, typically the onset before age 60, or a later age of onset. These early onset ages of Alzheimer's disease are more rare. They occur in about 5% of Alzheimer's disease. And of those, about half actually have a genetic cause. There's 3 genes. They are all, again, they're rare, but the most common of these 3 rare genes is the presenilin 1 gene. If someone has a change or a mutation in the presenilin 1 gene, it can cause a genetic inheritable form of an early onset Alzheimer's disease. For late onset Alzheimer's disease, people that have more onset to their 60s and older, there's not really a strongly known genetic cause. There's no single genetic change that 100% causes the disease to happen. There is one gene that's termed a risk factor gene. This gene is called ApoE. If someone has the form of the APO gene that's considered to be a risk factor, it increases their lifetime risk of having Alzheimer's disease, but it doesn't necessarily mean that they're going to get it. So this is one piece of information that we do know about late onset Alzheimer's disease and the genetics, but it's not a straightforward story where the genetic information automatically translates to someone having the condition. For genetic testing in Alzheimer's disease, the most straightforward area where we really talk about genetic testing is in cases of early onset disease. So people that have more onset in their 30s, 40s, and 50s that have a strong family history. And you can really see through the generations of the family multiple people being affected by an early onset form of dementia or Alzheimer's. In those cases, a doctor would recommend starting with the presenilin 1 gene and testing that. That there are two other genes, presenilin 2 and APP, or the amyloid precursor protein, that would also be tested. Determine if there is a known genetic cause for the family history of early onset Alzheimer's disease. For late onset Alzheimer's disease, since there's no straightforward genetic cause, a single gene that automatically causes late onset Alzheimer's disease, there's not really a genetic test that at this point a doctor would recommend. There is a risk factor gene called ApoE, but at this time doctors don't typically test for that gene because it doesn't give any information about diagnosing the condition or how to treat it. So when a family has a known genetic cause for a neurodegenerative disease, so either frontotemporal degeneration or Alzheimer's disease, individuals in the family who are at risk, so say the siblings or the children of the patient, could choose to have predictive genetic testing. Essentially what that means is it's a healthy individual who does not have Alzheimer's, who does not have FTD, but they want to know whether or not they inherited the genetic cause of the disease. In those cases, they could go through genetic counseling, talking with the doctor to weigh out the risks and benefits of finding out their genetic status. And if they decide that they see a personal benefit in knowing their genetic status, they could choose to have clinical genetic testing for that information. This is a very personal decision because there's no medical intervention, there's no prevention we can offer if someone finds out that they do carry a genetic cause. But sometimes, for personal reasons, people do want to know that information, and it is information that they can certainly be tested for and find out. When considering genetic testing, one of the most helpful things to discuss is a patient's family history. We find that family history is an important tool in trying to assess the likelihood that there is a genetic cause at play. For many of the genes that can cause a genetic form of a neurodegenerative disease, have a strong effect, meaning that you would see the disease in multiple individuals in the family. Sometimes some people may have disease symptoms that look identical to each other, but sometimes there can be a broad spectrum. Someone in the family may have more memory problems, while someone else could have more of a movement disorder. When looking at the family history, sometimes you'll see a really strong effect where multiple people in the family all have the same symptoms. They all have the same identical type of disease. But other times, individuals may have different types of symptoms. Someone in the family may have more of a memory condition or a cognitive disorder, whereas someone else in the family may have more of a movement disorder. Talking with a genetic counselor or a clinician that's really experienced with the disease in question, they can take all those clues from the family history and give feedback as to what genes might be appropriate to test and what is the likelihood that there's actually a genetic cause. Talking about genetics can be kind of scary. We're all, many of us are very close to our families. There can be feelings of concern or guilt when it starts looking like there might be a genetic or inherited risk for a disease. Finding out this kind of information can be helpful. It can help a doctor better answer questions about what to expect or what may happen in the course of the disease, as well as giving clear-cut answers to concerned family members about whether or not there's a risk to them to have the same condition that their loved one has had. This information is difficult and scary. It's part of the services that we can offer when it comes to answering the difficult questions about why neurodegenerative diseases occur and learning more about what we can do in the future to treat them.